Thank you.
Let's all rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning. Good morning. All right, welcome everyone to the Health and Human Services of January 8th. The agenda is before you. Any additions or changes?
I'll move the agenda.
All in favor, please say aye. Aye. Any opposed? All right, the minutes from December 4th, what is your pleasure?
I move them.
Any discussion? All in favor, please say aye. Aye. Brings us to limited public comment. Anyone that would like to address the committee, please come up and have a few minutes. No? Okay. That brings us to the Human Services Collaborative Council report. Callie, good morning. Yep, right up here. Yep. We are on the air.
Good morning.
Good morning.
My name is Callie Dempsey, and I am currently sitting as the chair of the Human Services Collaborative Council Steering Committee, so I'm really excited. Thank you guys for inviting me this morning to give a little update on the work that we've been doing together. First, I want to start with so much appreciation. We have many of our commissioners really engaged in our work in the Human Services Collaborative Council in a variety of different ways. We have Brian sitting on our steering committee. We have commissioners who participate in our regular monthly general membership meetings, and we have commissioners who are really actively engaged in our action team work. And so, thank you. This work is very collaborative, and it's been really exciting to see the evolution of this collaborative council over the last few years as we've been in some periods of transition. And so I just am here today to give you guys a little bit of an update on some of the work that's happening within the action teams. I brought a little packet of information that you guys can review. The steering committee has worked together this year to update some of our HSEC operating guidelines, and that was voted on and accepted by our steering committee in December. So I brought that for you guys to have and review. There are just a few updates in there regarding the structure and the work that we're doing together. What we've learned is, despite all of the resources and amazing organizations, service organizations that we have here in Eaton County, who provide services to the residents of Eaton County, there are still residents who are unable to have their basic needs met. And we've learned that the service delivery system is very complicated, it's complex, and it can be difficult to navigate for many of our residents. The Human Services Collaborative Council is the only place in the county that's working collaboratively to make it easier for Eaton County residents to access services that are available to them. We're really able to do this directly through the work of our action teams. Right now, the HSCC has prioritized 3 different action teams. You have a document in the back of your packet that's a little bit of an action team summary from 2023. On the back of that, you'll see our HSCC shared vision. So this is just the big framework of the work that we're doing overall. And on the front page of that, you'll see this action team summary. It really gives you guys a good idea of some of the work that's happening. I would just like to highlight a couple of really exciting things that have happened in 2023. We have a team called Easier to Find Services. That action team is very robust. It has a lot of very engaged members from our service organizations, from our commissioners. It's really exciting things are happening. One of the things that's been a focus of this team over the course of 2023 is to work directly with the 211 system and start to make that system a little bit easier for residents to navigate and for our service organizations to understand how to update the information that they store in that system. We hear frequently from residents and from frontline workers that 211 can be unreliable. And so this team has worked really hard this year to start to make some really, really cool improvements there. One of the things that we have seen is that 211, our regional representative for our state's 211 system sits in on that action team and participates in every meeting. She's actually leading that team right now. And they have provided information to us that in Eaton County, more organizations are updating the information in 211 to have accurate and accessible information when residents call 211 looking for their needs to be met. This is really exciting. This is directly related to the work that this action team has done this year. They spent a lot of time working with whoever, first identifying who the updater should be in all of the different organizations within Eaton County, and then training those updaters on how to log into the system and get accurate information updated. It's making it easier for people to call in, say that they have a need, and be directed to the service provider that can help meet that need in a really accurate and reliable way. What's coming for this year is that they will start to host a series of trainings here in Eaton County where agencies and their updaters can come together and start to work on the taxonomy of 211. There's a certain language that 211 uses because it's a national system. That language is not changeable. But what is changeable is for our Eaton County agencies to understand that language and be able to utilize it in a way that makes it more effective for people who are calling in for services. This is something that we have seen already is starting to have a pretty rapid change within a lot of our organizations. And last year, we utilized a couple of our HSCC meetings to host little trainings, and they were very well attended. I think over 200 guests for two of those. And so we're really excited to see that action team work this year to expand some of those trainings for agencies. Our second action team is our landlord engagement and affordable housing action team. And that team has been working directly on trying to understand ways that we can work together here in Eaton County to make it easier for residents to access affordable housing. And that's a very complicated issue across our nation, across our state. Right now, we're in the middle of a housing crisis. And so this team has really prioritized this work. Last year in 2023, the team surveyed Eaton County landlords, and we ended up receiving back 189 surveys from landlords that really indicated to us, those landlords gave us information and input on their experience with affordable housing programs, and it showed us that there is a lot of misunderstanding between landlords and the service organizations that provide affordable housing programs. And so based on those survey results, that action team is working now to put together some, they're calling them conversations, I think, and they're hosting group conversations with landlords to kind of myth bust some of those affordable housing programs and re-educate the county landlords on the value of using those programs, how to use them, how the process works, how the paperwork works, and answer any questions that they may have, with the intention of getting more landlords engaged in those programs and having housing easier to access by Eaton County residents. That way they know what programs are available and how to use them and how to get their tenants engaged in them also. And then the Universal Referral Application team is a team that I help to facilitate. This action team has been prioritizing how to make it easier for residents to get connected to the services that they're referred to. We heard from a lot of frontline workers in this county that it can be really difficult to get information sharing between organizations. So once somebody sends out a referral on a participant that they're working with, they may not know where did that referral go, what happened with those services, was this person eligible, and it gets a little bit muddy and complicated. And so this action team has been really working to make this process a little bit more streamlined and easier to access within Eaton County. Right now, we're really excited for the 2023. We're working right directly with DHHS to launch a pilot. We've developed some new tools that would be a universal referral follow-up form that all of our service organizations and frontline workers could utilize when they're referring their program participants to another agency, so they can get that information sharing to happen a little bit more seamlessly and start to make it quicker and easier for residents to access services. So DHHS is going to help us lead this pilot. We're going to work directly with agencies that already are referring back and forth with DHHS to see how are these tools working when we start to apply them. Do we need to make adjustments? And then we can get ready to start rolling these out to the full HSCC and to other agencies in Eaton County that may not be a part of HSCC. So we're really excited about this. That would help alleviate some of the frustration and burden that we have on our frontline workers here in Eaton County, and it would make it easier for our residents to get access to the services that they are looking for. It's really exciting to see the transformation in this work. Since 2020, the HSCC here in Eaton County has been working really hard to reestablish a new structure. Prior to this work, we met as a small group. I think the average was 14 to 15 people that would attend our HSCC meetings before 2020, and it really functioned as like a way for agencies to update each other on some information that was, or events that were happening within the county. We've really shifted now. We have over 50 active, engaged members every month from over 26 different organizations. We are utilizing the HSCC meetings for this action team work. So our meetings have been completely restructured where we have time for some learning and some education at the beginnings of the meetings. We have a full hour typically for action team work to start moving some of the work that you just heard me talk about forward every month. And then we have time at the end for those updates and announcements. The steering committee has been formed in the last couple of years. That's a group of 8 leaders from the HSCC who really help to guide the work that's happening within the Collaborative Council. I added, in your packet, you'll see the steering committee roles and responsibilities. This is something that is new for us this year. The steering committee worked throughout the year to determine what their priorities are as leaders of our Collaborative Council, and have been working to, this group is who determines what kinds of presentations are presented to the HSCC throughout the year, what our meeting structure is going to look like. This group is going to be tasked with looking at sustainable funding models as we continue to do this work. And they're also really working to develop a metric system to see how are we measuring the work that's happening here in Eaton County, and how do we promote awareness of that work. It's really exciting to see what's happening. We've really transformed this work. It's very collaborative. It's been very exciting to see what can happen when a group is working together with a common agenda and a shared vision. We have that vision framework that really helps us all. Even though we're all coming from different backgrounds, different organizations, we all have different priorities in the work that we're doing, but this shared vision has helped to kind of guide us in this collaborative effort. We're using evidence-based models such as collective impact to guide this work and to help our steering committee guide the work of the HSCC. And we are starting to gain a lot of interest from other collaborative bodies in our region. We have people very interested. There's groups within the region, other collaborative councils, other counties who are looking at Eaton County right now and how we're doing this work together and starting to utilize a lot of the tools and resources that we have put together to move this work forward. So we're really excited to see what is to come for 2024 as we get started. So that's our update this morning. Does anybody have any questions for me?
Questions for Callie? Oh, Joe, go ahead.
Thank you. I was interested in your comments about housing. Commissioner Pearl Wright and myself have been serving on a tri-county action group that's tried to pull as many stakeholders as possible over the last 6 months in regards to housing in the tri-county area. Is the survey that you conducted, has that been reduced to some kind of a 2 or 3 page report?
I believe that the action team has their survey results. They presented, so we do in-person celebration events for the action teams to present their work to the collaborative council. I am not on that action team, so I'm not sure how they I don't know what the report is like, but they do have that information. We would be able to get that and provide that over to you. I also believe that there's members on that action team that are part of that regional collaborative.
I would assume that,
Yeah.
or I would hope that would be true. One of the, we've had at least 3 major meetings.
Yeah.
And one of the problems that I have with the whole concept is that we appear to be, in a lot of ways, spinning our wheels because we're going to reinvent the wheel. We're asking questions that in your case, you've indicated have already been asked, at least in some situations. I would find that report helpful.
Yeah.
And I would think that it would, now that you're aware that Commissioner Pearl Wright and myself are involved in that you would keep us updated on anything that the collaborative council might do in regards to housing in Eaton County. Both, we're looking at the entire picture, I think, as you know, not only in terms of ownership, but rental.
Yeah.
And we're trying to look at it from everyone's different angle. One of the things that we're trying to make sure is we have the correct stakeholders involved. But I'm very much interested in seeing if there's been a report generated. I don't want 189 surveys, but if you have a report that's been generated of some kind to give me some idea,
Yeah.
I would appreciate being given a copy.
Yeah, we have a Human Services Collaborative Council coordinator. Aiden Foster Fishman she takes all of our notes and pulls all of the data together. They did do some data analyzing of their survey, so we would be able to provide you with a couple of different things. The survey itself, so that you could see what questions were asked to those landlords, and then they'll have some form of analyzed data. I don't know what that report looks like, but I can get both of those things over so that you guys can review that and get you guys the information on when those meetings will be throughout the county that invites landlords to come and learn a little bit more about our affordable housing programs.
All right, thank you very much.
Yeah.
Jeannie?
Commissioner Brailer, I am on the landlord one and routinely attend it. We are striving to educate the landlords so that they don't, remove people from housing just because of maybe a back month or two of rent and things, so that they're aware of what programs are available, because a lot of these landlords, they don't know that there's extra help out there. So, or to even include wanting to work with those programs. So that's where that landlord engagement component's going to come into being. What we're finding is they don't even know that there's help out there if somebody's behind. So,
Yeah, I think that the survey results will back that up. There's a lot of landlords here in Eaton County that are not aware of the supportive housing programs and different types of affordable housing. And the ones that are aware have some negative ideas or misunderstandings about those programs and have been a little hesitant or unwilling to work with third-party payers. And so this action team has been doing a lot of work to help re-educate landlords so that they understand how those programs work and the benefits to them to use them. And I think there's a lot of conversation about some incentives on what can be provided to landlords who do engage with those programs. And we're really excited about that. So we can get you the results of those surveys. Do you know how the report has been pulled, Jeannie?
They have a report. I wasn't able to attend the celebration meeting to show that, but I have seen a lot of the data throughout this time because I was at a conference for MAC. So I don't know what she presented. The one thing is, Commissioner Brayler, is that,
That was fun.
no, I'm trying to think, Emma Gilbert that you see at our summit meetings, she's also going to be part of this presentation to landlords because she has all the individual county data. So she's going to work with the Eaton County one so that she can show why the need is, to expand all sorts of housing types over here in Eaton County. So we're working on it. But, landlords are their own businessmen too, so.
Well, I think most of you know that I have a certain idea in regards to landlords, but the reality is that, and this whole summit thing is really being pushed, I guess, by the governor of the state across the state to solve the housing crisis that we have in this state. But it's clear that this problem is national. And there's going to need to be some type of mix. Not everybody's going to own a home, or at least own a home immediately. So there has to be some kind of a system put together. I think at the end of the day, the real question is, what are you trying to accomplish? Which is the first question that I always ask. And if you're looking to make sure that everyone has adequate, affordable housing, that's one thing. If you're looking at trying to perpetuate a system in which there are some who are in it for a profit and are doing well, that's an entirely different system. My concern with the summit, as I said a moment ago, is I think the 3 meetings that I've attended so far, one I thought was very good, one I thought was very poor, and the third was kind of somewhere in the middle. We seem to be constantly just spinning our wheels. Everybody seems to understand there's a problem, and part of it is that in bringing together all of the so-called stakeholders, we don't seem to move in a direction. There's a huge difference between someone who has a real estate license and wants to make a lot of money to provide for their family, and someone who is a landlord, as opposed to someone who is working a job that's paying them $16 an hour or whatever, and they've got 3 kids and they're trying to put a roof over their head. And that whether the summit will accomplish anything at the end of the day is, to me, still an open question. But I'm interested, one of my concerns has always been the overlap in terms of various organizations doing the same thing. And at some point, it would be nice if we could pool our resources. Housing is a perfect example of that. But it's true in other ways. I've served on the coordinating committee for substance abuse almost the entire time I've been on this board. And at some point, we need to pool the resources that these various organizations have and start deciding that we're going to be able to deal with these problems as opposed to everybody doing it in their own little niche, in their own little backyard.
You bring up a great point, and I was going to use it as an example. For instance, because that is one of the many concerns that come up constantly with this type of group, not just HSCC, but these types of groups, of the overlap. Now, I know Christy Harry is on this committee, and again, who is the Director of Housing Services. So I guess, in brief, not asking to go a full dive down the rabbit hole, and from what you know, I know you're kind of new to the seat. But where does, I get the part where this is a place for a lot of these department heads to communicate and collaborate, but at what point are we, to Joe's point, are we solving a problem that there's an agency that already exists to try to tackle a certain problem? I don't even know if that's a fair question for you, but.
It is. These are such complicated and complex issues, right, that all three of the action teams have been formed around. It's what our county has prioritized. Housing, as an example, is one that Eaton County prioritized, understanding that the state and the nation, HUD, is kind of prioritizing some reform in this because we are in a housing crisis. And so with the work that this action team is doing here in Eaton County, like you had said that you feel like there's maybe some overlap or like kind of going in circles. It's just a complicated issue to solve when you bring a whole large group of stakeholders together. An example of our action team is that here in Eaton County, we have agencies who are really invested in housing, like Housing Services, really actively engaged in this work specific to this county and are starting to kind of shift that needle forward. So while Housing Services is an agency that provides housing assistance to residents of Eaton County, they are direct service providers. So they're kind of right at the front lines of this, right? They're helping if somebody is homeless or facing an eviction or a foreclosure, that's the agency that they're going to, and they're working really hard to meet those needs as they're coming in the doors. They understand that there is a bigger issue here and that there's a breakdown in that we are in the middle of a housing crisis, and how do we start to solve some of those issues? And as that team kind of dived in and asked a lot of questions together last year with some of the experts in the county who work in the housing field, they identified that one of the things in Eaton County that could really shift this is if more landlords engaged in these programs with residents of Eaton County, and they really started to tackle that as a very regional, local issue going on and have started to shift what that looks like here in Eaton County. Also, engaging in those regional efforts to make sure that the work that's happening here in Eaton County can start to expand out, or that we understand what's going on in the regional work and the state work and the national work, so that we're keeping pace with that, but that our focus is the residents of Eaton County. And so how do we not just go around in circles around the issue? How do we start to really make a difference and make it easier and start to tackle that housing crisis here at home with some of our experts? And so it's been really great to see leaders. The HSEC action team work is really, it's really incredible to sit in on these meetings because we do have people like Christy Harry, who's an executive director of a housing agency who is actively engaged in that action team work. And we have frontline workers who are working with program participants and Eaton County residents and understand what those residents are going through. You know, we kind of have all levels of experience in the work happening together and can keep it very specific to what's going on here at Eaton County.
Thank you. Yeah, go ahead.
Excuse me, I'll add to that, too, that Christy Harry is on our landlord group, and she has a frontline staff member. So they are definitely on board with this, trying to identify more landlords in a group to get them engaged in using those programs versus when the clients or the people who need new housing end up showing on their doorstep. So we're trying to get ahead of the game instead of behind the game.
We call that upstream work. So we really, you know, there's two parts. It's like Housing Services doing direct work, meeting that need, putting those fires out for people who are in crisis. And the work that the HSEC action teams are doing is a further upstream, trying to shift things within our system that start to trickle down and reduce the amount of crises that Housing Services is having to deal with every month, if that makes sense. So for Christy, it's valuable to be, you know, meeting those needs as they're occurring, but it's also really important to her and her agency to start to shift and do some of that work upstream. And she shows us that that is important to them because they show up to every meeting, and there's multiple agencies engaged. And that is the same whether we're talking about our landlord engagement group, our universal referral group, or our easier to find services group. Many of our action team members are providing that direct work to reduce crises as they come in, and have articulated to us the value of being involved in this work a little further upstream with us.
Thank you. Anything further? Oh, go ahead, Blake.
Yeah, and I guess I want to thank you for this organizational document and some input on your teams. I've been on this committee for many, many years, and I've been involved with the collaborative for many years. And frankly, we've done a lot of wheel spinning, and what Commissioner Brailer and Pearl Wright refer to, it's analogous in all these areas, in substance abuse or in mental health. We've got these groups that it appears finally, after a couple of years ago, we sort of reorganized this group, and it appears that we're making some progress. We're actually trying to accomplish something rather than just having this meeting
Yeah.
every couple of months. So I'm positive by the direction that you're going, and I think some of your action items here have needed attention. It's almost shameful in some ways, the 211 system. We've had it for decades, and it's complicated. I mean, the people that need the services can't understand how the system works. I mean, it's like, come on now. And I appreciate what you're doing, and I think you're on the right track. And I just want to say that. Thank you.
Thank you. We couldn't, I mean, it's very collaborative, and it has been a really incredible transformation. You know, we're using these evidence-based models like collective impact. We have a backbone team at Eaton Community Health who really has been funding, having a coordinator for the HSCC for the first time here in Eaton County, who can really help us to bring some real action items to, this shared agenda, and this shared vision has been transformative here in Eaton County. And it's been a lot of work. It's been years of work now. We've been at this for 3 years, really trying to shift how and why and what are the priorities of our Eaton County Human Services Collaborative. What are we doing together, and why are we doing that together, and what is the impact? And we're at a place in this work now where we're seeing these action teams really start to move work forward in a way that's getting the attention of other collaborative bodies in the state, noticing, like, how are you guys doing this? What are the steps that you've taken? What are the tools that you're using? And we're sharing this information. I've presented at a number of collaboratives around the state in recent months to kind of explain what collective impact work looks like, how Eaton County has this backbone support team really helping to keep this work moving in the right direction, and engaging leaders that are very busy doing a lot of other things, and keeping them coming back and helping, provide input in this work with us. So we're very excited about it, and we're very excited to keep you guys updated on the work that we're doing.
Chairman Mott.
Yeah, hi, Callie. Thank you for coming today and giving us a presentation. I just want to thank you for stepping up and taking a leadership role, because we know Barb Fulton has done a very, very good job and brought a lot of energy, and no doubt you're doing the same, and I know it puts a lot more responsibility on you, so I just want to thank you for taking on that role.
Yeah, Barbara is an amazing leader to learn from. So I'm very appreciative of all of the energy and effort that she has invested into the Collaborative Council over the last 3 years, and am very proud to temporarily fill her shoes until she's ready and able to come back to this work. So thank you.
Well, thank you so much for your presentation.
Yes, thank you.
Have a great day.
Thank you.
All right, that brings us to strategic plan, substance use and misuse update.
Yep, that's me. So this is a regular item we've been putting on the agenda to let you know what's going on with this. So we reported last month about the meeting that they had in December. They will be having another meeting here in January on the 17th, I believe. And we have also now engaged with MSU, not Extension, but MSU University proper for some of the community impact surveying. So those meetings will start this month as well.
And I would invite everyone to the next meeting if they're available on January the 17th at 9 o'clock a.m. at RESA. Is that correct?
Yeah, I'll send everybody a meeting invite. I'm making a note right now.
Very good. Committee appointments. I have to wait for it to go up.
Oh, you scroll it, yeah.
That would be on me.
That's all right. No worries. Hey, ooh, back up. There we go.
Yep. So there was a resignation on the Community Mental Health Board and on the Eaton County Human Services Collaborative Board. It was the same person. It was Kay Randolph.
Okay. Very good.
And there is application that we received back in November. And so we called Ms. Jensen and asked if she would be interested in one of these and if she would like to come today. So she is here.
Yes. Welcome back, Dr. Jansen. All right, yep, and you have, everyone has I believe, a recommendation letter in front of you from the chairman of McHenry County Board. I guess to be clear, yep, go ahead.
I would move that we appoint Ms. Jensen to the Community Health Board to fill the unexpired term.
Second.
All right, any discussion?
I would simply indicate, and I've had a chance to speak with her both today and the first time that she came. She's a former county commissioner out of Illinois. She served on the mental health board in Illinois. She served on their finance committee as well. I think that she brings a wealth of knowledge and would be a tremendous asset to community mental health. I think both Illinois and Michigan systems are different. And I think it's that difference that, and her experience in serving, that would be of great benefit to the board. And so I would ask that everyone approve this nomination. Thank you.
Very good.
I
Oh, go ahead.
I also would wish that she be approved to serve on our CEI CMU board. I have had a couple of opportunities to speak with her about her past experiences.
All right, all in favor, please say aye.
Aye.
Any opposed? Very good. Thank you very much for coming. Appreciate it. We look forward to working with you. Thank you. Thank you. All right, semi-annual agency reporting schedule.
This was just a notification, so you understand when the different agencies will be reporting to your committee.
Any miscellaneous?
No, sir.
Brings us to the last limited public comment. Don't all rush up at once. Okay, good deal. We stand adjourned.